improve uh, our ability in medicine and in the English. Yeah.
Wow,
Okay.
cool. So you're having fun.
uh, I don't know. I may be or not, but I feel better now than
Mm,
last semester, and I've a progress. I have fast the estimation in the last semester, so
mm-hmm, mm-hmm.
it's time to me to prove that maybe I suitable for to be a OBGYN. Okay.
Oh, okay.
I have
Great.
still more 4 semester our yes maybe 3 semester to pass this education. But for the 1 year in the 1 year in the for this year it is a difficult year. I must to pass this year.
Mm, okay. So how is COVID-19 in your hospital?
Well, actually, I don't know how the amount of the patient, but because in the OBGYN, uh, we just treat the people who actually will really in the COVID-19. Maybe I mean that we just treat the patient in the pregnant woman who was COVID-19. But for the all of the I mean that for the amount of the patient in the center, I don't know what is the exactly.
I see. So do you wear full APD when you work?
Yes, of course. We must use this. We must use a feed if we work in Sarjito. That is the protocol.
Oh, I see.
Sometimes sometimes it's so tired because it's so hot
Yeah.
and it's so many so many energy. It uses so many energy. Mm.
Yeah, you need a lot of energy when you work wearing that
Yeah.
suit. So
Yeah.
how's the patients? How's the patients so far? How many patients? No, how many pregnant women have you treated who are positive COVID? Who
Mm,
are COVID positive?
until for until for until for this time, I think the patient that I was treat is maybe 100 maybe I think.
Oh, wow.
Yeah,
Oh, is there
from
is
January in this year until now.
okay? Is there any fatality?
Yes, some of them, some of them died. Maybe, but just a little bit.
Okay, there are not many pregnant women die because of COVID-19.
Yeah, just a little bit. Maybe just I think 5 until 10% from the all of them.
That's still a big number though. You know,
Yeah,
10%? It's still big, right?
yeah. Yeah, but I don't know what happened today in the world. It's so horrible now. The COVID
Okay.
19, we must fight in the COVID. We must fight in the hemorrhage antepartum. We must fight with the
Wait a second. Wait a second.
uh,
That was medical term. That was
okay,
medical term.
yeah,
I'm not a doctor. Remember, I'm not a doctor. Come on, plain English, please. Plain English.
yeah. It's I use English now. That is the word of the English.
Okay, what is it again?
Huh? Yeah,
What is it again?
we must. Yeah, yeah. Okay, we must fight. In the other side, we must fight to COVID, and the other side, we must to fight with hemorrhage and bleeding. The bleeding and the
The bleeding.
fartum.
See,
Yeah, the
that's
bleeding.
what I meant by plain
Yeah.
English. No hemorrhage, but bleed.
Oh yeah.
Please.
Oh yeah. Bleeding postpartum, bleeding post delivery, bleeding post birth. Nah, dia and the other the another um another the mortality rate. The cause of the mortality rate in the pregnant woman. The first one is the heart disease. For the woman,
Heart disease.
the
Oh,
woman with
okay.
heart disease. Yeah, because if you have a heart disease, if you a woman who have had heart disease, in the category, maybe in the category, in maybe I think it, yeah, safer heart disease. Yeah, it's cause the mortality. It costs that.
Okay. How about women with diabetic?
Yeah, what?
How about the women with diabetic syndrome or diabetic
Uh,
disease?
no, there is there is if if we therapy with the if we can control the glucose or we can control uh blood blood glucose blood. Yeah, I mean that is the gula darah is
Blood
um,
sugar.
blood sugar, yeah, the blood sugar in the normal limit. We can prevent from the worsening. Yeah, you know that the one of the symptom of the woman pregnant woman with diabetic is can make him to the advanced stage in the heart disease, and
Mm.
maybe
Okay.
she will have a big baby. And if you have a
Oh,
big baby, yeah, if you have a big baby, so
surgery
you
is the
can,
option.
yeah, surgery adoption, and the baby will have genetic diabetes, and maybe they will be respiratory distress syndrome, some lack of the um, lack of lack of the normal, what's the normal lung, ya. Yeah, you know that.
Oh,
I mean that syndrome pernapasan, ya. I mean that.
I see. So heart disease for pregnant women are more is more dangerous than diabetic.
Yes, but the disease in pregnant woman is more dangerous than diabetic if we compare
Okay.
the mortality rate.
Okay. What about women with high blood pressure?
Yeah, woman, the pregnant woman with the high blood pressure, uh, the in the prognosis is different. How to
Mm-hmm.
control the blood pressure? If we can control the blood pressure in the normal limit, and we have already prevent with the medicine,
Mm-hmm.
we can prevent the worsening. Some of kind of the worsening is like preeclampsia. Eclampsia itu, the symptom is like your kejang.
See,
Mm.
so having so these women
Caesar,
having
Caesar,
seizure.
Caesar.
Okay.
Caesar, yeah, Caesar, and if the Caesar continue to other stage, so they will be like plasma cakes,
What is that?
plasma cake, plasma cake, kebocoran plasma cake,
Ow. Ow. Ow.
kebocoran,
Okay.
kebocoran,
Okay.
ya.
So what does
Mm.
that? What does that thing do inside someone's body?
Oh yeah. The plasma is in somebody, and maybe in your blood. I think in your vessel. Your vessel
Okay.
is
So
the
what's gonna happen if that thing happens? If this leakage cannot be prevented, what's gonna happen next?
the end of this stage is die.
Okay. Okay. That's frustrating. Wow. That's scary.
Yeah, it's so scary.
So scary. Okay.
Maybe I must take a breath to start conversation. I think it's so fast and make the word is not make the sentence is not not teratur ya you see you know
Wait, you're
I
talking about
must
your English?
yeah I must speak slowly maybe. What do you think?
I hear you fine because
Okay,
I understand what you're saying, so no problem.
okay.
No problem. Okay, so what is the worst patient that you have ever dealt so far?
mm, the the worst person that I have. Yeah. I remember in the last year in the Banyumas Hospital when
Oh, wait, so
I
so you were not always at Sarjito?
yeah
You go
yeah
around. Oh,
I'm not
okay, okay.
I'm not always in Sarjito.
Oh, okay.
I can go to another hospital
Oh, wow,
if
okay.
the but it's different on the your duty. You
Mm,
know that you will be choice. We will choice. Yeah, choice. Yeah, choice. Yeah. What they say?
okay.
Choice. Yeah. You will choice.
Terpilih?
Will be choice.
Terpilih or
Yeah.
what?
Dipilih,
Terpilih is
dipilih,
chose.
dipilih.
Oh, dipilih is
Choice.
chosen.
Chosen. Yeah. Yeah.
Mm-hmm.
You must. It's depend of your choice and where the first you will get the dati.
Okay.
Uh, yeah, in the last year before pandemic, we always uh, we always move from the one hospital to another hospital every week.
That's
Yeah.
that's that's so that's no. It's scary, I guess, because
Oh,
Sarjito Hospital has the top-notch prevention. I mean, the APD there are super complete and.
yeah. But
Uh-huh.
that is happened before pandemic.
Oh, okay,
Now for the
okay.
pandemic, I no, there is the hospital have worked together in hospital.
Okay.
Yeah, it that kind of agreement.
I see.
Yeah.
So
So
it's like you're doing your koas.
yes,
You were sent there and here
can
and then
can
to
of
other
this,
hospitals.
can of that. Yeah,
See, I see.
that's true. I said that semacam itu can of that or
Something like that.
something like it. Okay,
Yes,
something like
something
it.
like that.
Okay. Mm.
Well, do you still go to class? Do you still listen to lecture, or do you still have theories in the classroom?
Yeah, of course. we to be OBGYN, you must have a skill, you must have a lot to read, and you must have more. Yeah, it's the fusion of the conjoint and skill and your brain. You
Okay,
know,
okay.
yeah.
I see.
Why I choose one of the reason why I want to improve my English because yeah, I must speak in the front of the my college, my professor as part of that is examination. Yeah,
Mm.
it's
So your exam is in English.
sometimes yeah apa namanya something like that. Yeah, something like that. Hmm.
Oh, that's a lot of pressure, I'm sure.
Yes, of course. Every day is a pressure. Every day. I'm so tired actually, but I just hope the God give me a lot of ability, give me always protect me, and always make it easy to me, because uh, in other side we must practice in the we must practice in the skill our operation our skill to delivery baby. In the other side we must read a lot, we must answer the question, we must make a referat, we must presentation in the front of them in the conference. The conference is always in the always happen in Monday and Tuesday.
So wait.
Tuesday.
So you have a conference every Monday and Tuesday?
Yeah, but it's depend of a month you resident in your semester.
Oh, I see. I see.
Yeah,
So
yeah,
you work in a teammate, in a team.
yeah. In it's depend our teammate. Nah,
I see.
uh, the lucky apa namanya? But yeah, because my teammate the total of my teammate is 13.
That's a lot.
So
That's a lot.
yeah, so we can also we have get we have get the opportunity in 2 times in 6 months, 2 times in 6 months.
I see. I see. I see. Well, that sounds fun. That sounds fun to me.
uh
No.
I think
Okay.
it's not fun.
Okay. All right. So how do you compare your English with your teammates so far?
mm, first my teammate my other another teammate is younger than me.
Mm-hmm.
Almost of them clever than me in the almost of them clever than me. So I think
In terms of
they
what? Cleverer than you in terms of what? Speaking English or
speaking English and the theory, yeah,
okay.
and just and the theory. Sometimes it makes me insecure,
Oh.
but yeah, but I believe that the I believe that I was go. I believe that yeah. What I mean, yeah, what I want to say, yeah. I believe that that is my destiny in there. So I think I can competition with But there
Okay.
is not competition. But it's not competition. If we fast together, so we will do all of this job in this matter with easily, you know.
Mm.
Yeah, yeah. If you have a small number in your teammate, you have a small number in your teammate, your job is so big. But
Mm.
if you have a lot of people in your teammate, you can divide your job in
Oh,
one, in
yeah.
another one. That is
That makes
make
sense.
easily. Yeah.
That makes sense. Okay, so how good are they in speaking English?
Yeah.
Are they fluent?
I yeah.
Are they fluent?
No, I think because we never speak English each other.
So why
We
why
just speak English.
why do you feel insecure then?
Yeah, you know, yeah, I sometimes I don't know what why. Sometimes I don't know what I must to say in the English. It's hard to me to it hurts to me to make a sentence. You
But
know.
you can make sentence now easily, even though sometimes you stutter.
But I think my sentence is not. It's bad. I think.
I told you before, right? As long as your partner understand what you're saying, then you know what? Fuck grammar.
I
I
don't
can see
know.
I can see it from your face that you always think about grammar, right?
I just want to make the right sentence.
The right sentence,
I
you know what? The right sentence is
yeah.
the sentence that can be understood by the speakers and the listeners, you know? So I can see that you always think about, oh my God, what grammar should I use, right?
And I'm always think what is the the English of that verb. What is the English of the what is the English of that word? It's sometimes I forget what is the vocabulary of this word, that word,
Okay. Anyway, from 1 to 10, how fluent are your friends?
How
From
mm,
1 to 10.
no, they of them never found me to speak English. I speak English now. I try to learn English now because I feel so fair if I have a chance to presentation in the front of the class, in front of the professor, in front of the doctor, in front of my colleagues. I can say anything.
You what?
I
You cannot say
feel fair.
anything?
Yeah, someday I feel it's I'm so fair. I'm so fair. I can I can I I'm fair. I'm so fair.
You're
If
you're so
if
afraid?
they yeah, I'm so afraid if they can understand what I say.
Okay, but you have watched your teammates do the presentation, right?
Yeah,
Okay, so from 1 to 10, how good were they?
I think
Let's say that I'm a 10, okay? So from 1 to 10.
mm, 7 maybe.
7, you sure 7?
Yeah, 7.
That's a that's a small number. You can do it. You can do it. If you set 10, then oh okay. I have to work hard to teach you. But when you say 7, then not a big deal. You can do it.
Yeah, maybe. Because I think some every I have
You're
heard
sorry, the
still
signal
on it.
is
Yeah,
not good.
yeah.
Like
Uh,
like I said, don't be insecure. 7 is not a big score, okay? If you set 10, then okay, you have a lot of things to do, but when you say 7, it's easy.
yeah, because I think her grammar is bad. I think they are just say, and the audience has understood the meaning.
Yeah, now my question is, why do you feel insecure? What's the
I
reason
don't
behind your
know.
insecurity? You have nothing to be insecure about.
Yeah, I
Every time
feel
you feel
so
insecure,
good.
every time you feel insecure, you will not learn anything. I'm trying to change your
Yeah,
mindset here, okay? No more insecurity,
yeah.
okay?
Okay.
All right, do you want to try to present something to me now?
Presentation about the
The
maybe
cancer?
the in the
Or
no
oh no,
maybe
okay.
maybe I will present about the last presentation that I have made. Okay.
Okay, okay,
Yeah.
sure,
Okay,
sure.
we to
Go ahead.
try to make.
By the way, this is recorded, and later on I will send you the file or the link so that you can evaluate how you can improve.
Okay.
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 All right. Do you know how to share the screen?
I don't know how to share. Maybe I must click the button in cost share tray or another button in this camera.
Actually, on the top of the screen, you
Okay.
see the you can see the icon of the camera, and then you can see the icon of the microphone, and then something next to it. Can you see something?
Okay. More. Oh
Yeah,
yeah,
it's
yeah,
share
yeah.
content. Yeah, you can use that. Take your
So the
time.
present software. Okay, I will wait a minute. I will try
Okay, take your time.
to share.
Another question from me. When your friends present something in front of the class, do they read the slides or do they speak like freely?
They read the site, but they are at the sentence to explain this slide.
Okay.
Yeah, you know that except they read the site, they have to
Explain.
explain this the site.
Oh, okay. Okay, take your time. I'm waiting for the
Uh,
share content.
in the beside in microphone tuh.
Yes, yes. Next to the microphone icon.
Oh, oh yeah, wait a minute.
Okay, take your time.
Always is always the uh okay. You can see my
Not yet. Not yet.
not yet, yeah.
I have a question actually. How when this is related to our conversation last night. So you said that you can feel something when you palpate the skin. How do you feel that? How do you do that?
Yeah, because if you have a mass if you have a larger mass in your abdomen, in your stomach,
Uh-huh.
you can feel that.
Oh well, actually, I'm fat, so I cannot feel anything under my skin. I tried it. You know what? I tried it
Yeah,
once. I tried it once. What is
yeah,
that?
yeah, yeah. If
I
you
think
can
you.
feel
Uh-huh.
that, if you
I
can
think you
feel,
share
if you can
something
feel that,
wrong. Uh-huh.
if you can feel that, that's meaning you have not a larger, much larger.
Oh, but okay. So, have you ever dealt with fat patients?
Yes.
How do you do the palpation then? I mean, they're fat. Do you just push deeper or?
Yeah, I just I'm just first deeper, and now we must we must check the more examination like ultrasonography, and
Oh,
we can with ultrasonography we can find the mass.
I see.
If already screen, I don't know how to see this screen because it's the first time I use. What is this?
Take your time. Microsoft Teams.
I don't know.
I
Any
think you
person,
have.
yeah.
I think you have to open your PowerPoint slide first.
Okay.
Okay, have you opened it?
Mm, okay.
Okay, and then go
Yes.
back. Go back
I have already
to.
open.
Okay, go back to Microsoft Teams and hit the icon of share content.
Mm,
You did. I mean, tadi sudah kelihatan, but I don't think that it's the right page that you shared.
mm,
Okay, you're sharing my.
Screen. Oh
Take your
yes, this.
time. I see security and privacy. Is that the page that you're going to share? No, right? Yup. Great.
Okay.
Yeah, I can see it. Oh, okay. You have to explain to me because I am noob. I know nothing about this.
Yeah, this is my parental cleaner conference in the last semester. So
Okay.
maybe I
Stop,
would
stop,
like
stop
to
from the
try.
title. Yeah, stop from
Okay,
the title. What is
okay.
perinatology? Oh my god, the terms, the medical
Parental
terms.
Yeah, clinical conference is the about the competency. Other conference is about the what is the management, what is the antenatal. I say okay. This conference is
Mhm.
to match USG antenatal ultrasonography before baby was born,
Oh, okay.
and we match we match it with the current condition of the baby. Can you
Yes, yes, got it.
understand?
I
Yeah.
will,
Okay.
I will ask question if I don't understand.
Okay. Okay. Yeah. This is the conference. Yeah, that I have ever met in the 9 Monday 9 November 2002. Okay, let me try to comprehend to thank you for the opportunity. Let me try to presentation this case. Okay, yeah. The case, the name, baby, Mrs. L. The age is 12 days. The doctor in charge, Dr. Deti Siti Nurjati, MPH, PhD, OBGYN consultant. The diagnosis of the mother diagnosis is G1P OAOGA 32 weeks 1 day, mother with reactive AGM toxoplasmosis, asymptomatic UTI, fetus with severe bilateral ventriculomegaly. And baby diagnosis is neonatal pneumonia, neonatal jaundice, exchange transfusion, ventriculomegaly, early onset sepsis, neonatal seizure, congenital toxoplasmosis, very low birth weight, preterm, appropriate gestational age, spontaneous motherhood, preterm labor, reactive AGM toxoplasmosis, fetus with bilateral ventriculomegaly.
Yeah, what are those?
This is
What are those? What
okay.
are those? What are those?
Yeah,
Reactive
there's
IgM
the
toxoplasmosis. What is that?
This is of the toxoplasma. Did you
Oh,
ever did you ever had the toxoplasma?
yeah. Oh, okay. What is
Yeah,
IgM?
IgM is the antibody.
Okay. So this mother
Uh
has toxoplasmosis.
yeah, this mothers it have the toxoplasmosis. How
Oh,
we can know the mother have toxoplasmosis? We can check the blood, and the result is we will find we will find the abnormality of the antibody titer. I mean that
mm,
IgM or IgG in the toxoplasmosis. Yeah. That means the rising of the normal limit.
okay. What is UTI?
UTI, urine, UTI, uh, urine tractus infection. Urine tractus infection is the disease infection in the your your mixi. Mixi is the traction no, the traction is the what I say here. The traction is like
Keep trying.
UTI
I'm
is
enjoying this.
UTI is the infection in your pee.
Oh, I see. So
Okay,
when I pee, it hurts. Is that the same kind
yeah,
of
when
thing?
I pee, yeah, we can collect the UV, and then we send to the laboratory,
Mm.
and if it have rising in the normal limit,
Mm-hmm.
like visit our white cell, and bacteria have found in the your your fee. Nah, we can say that that is UTI.
I see. Okay, so there is an infection, but this person does not show that because you said
Yeah.
asymptomatic there, right? Okay.
It has been divided into first UTI in asymptomatic and the second in symptomatic. The asymptomatic, you don't feel anything. You don't feel
Mm.
anything. But if you have a symptom like a fever, like a fan when you pee, and something you feel hot, you feel so hot in UV, nah, that is the symptom of the UTI.
I see. Okay. All right. Severe bilateral ventriculomegaly. What is that? Oh my God.
Ventriculomegaly is the some organ in your brain is that is the name of ventricle. We have three ventricle in our brain. The
Mm-hmm.
first is lateral ventricle and fourth ventricle or fifth ventricle. That is the name of the three of the ventricle. So if we measure the distance of one ventricle to other ventricle, we can say that is the have a dilatation our is it's normal, it's abnormal, it's not
Oh,
normal.
okay. Okay. So basically, it's bigger than the
Yeah,
normal size.
the
I see.
ventriculomegaly.
I see. Okay. All right. So neonatal pneumonia. Pneumonia is the lung disease, right?
Yeah, it's the lung disease, pneumonia, the kind of disease that caused or that caused by bacteria.
Oh, bacteria.
Uh,
Okay.
yeah, but it can cause the another 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 what is the meaning word another yes something like virus and something like I forget what I must to say is jamur what is this jamur
Um,
jamur
wait, mushroom? No way. It's medical term, right?
yeah not the
Fung,
mushroom jamur
fungi,
fungi
fungi.
fungi fungi
Yes.
fungi yeah it's the cause of fungi yeah okay.
Okay.
Mm-mm.
All right, and then exchange transfusion, post exchange transfusion. So after the transfusion,
Yeah. Post exchange
what?
transfusion is the baby. I actually in this perinatology. In this actually, I not really understand what is the meaning of exchange transfusion because that is not my my bidang my bukan bidangku ya what
Okay,
is the
it's not
say.
your area of expertise.
Yeah.
Okay.
This is not my area
Oh,
expertise.
right,
That
because
is
this is about
the
the baby, not the mother.
this
I
baby.
see. Hmm.
Uh, from my discussion with the parentalology resident,
Mm-hmm.
he said that the external thrombosis is when we use the blood of other and we take the blood from the baby and
Mm-hmm.
we change to the blood with the our adult man orang dewasa ya what's the
Adult, adult.
adult yeah adult yeah that's the meaning.
Ah, okay. And then ventriculomegaly, ventricle that is bigger than the usual.
Yeah
Okay,
I think
early
I
onset sepsis. Sepsis is the death of the cell, if I'm not mistaken. Early onset sepsis? No?
say wait a
Oh, okay.
minute I must call wait a minute I must call
Yeah, sure, sure, sure.
the
Okay.
ya kamu lihat apa dulu ya. Ya, kamu lihat update dulu. Wait a minute, miss. Wait a minute. Oh. No. Oh, jam 1, tapi sebelum jam 1 ya? Iya, iya. Males sih. Lagi, Pak. Pak, kirimin aku bahan, Pak. Ini aku kirim aku bahan, IR. Udah mana sih? Iya, tapi yang agak gampang gitu, Pak, bacain. Iya, Pak. Yang itu, yang endometriosis, yang buat buku biru itu, Pak. PCOS. Nah, iya. Wah, gitu. Bahasa Inggris, Pak. Enggak, buat Zoom aja. Yo, enggak lah, kalau kamu kan udah bisa, gue mah bisa. Ya, gue mah biar biar bisa biar bisa ngomong malu gue kan mau ada perubahan dari tahun ke tahun. Iya, ini saatnya PPU berubah. Sesuai ya. Gue guys sampai jam 8 kok. Nah, ya.
Wow. Okay.
Oke, Miss.
All right. Ready?
Yes, we
Okay.
continue. Okay, I'm ready. Okay, ya.
All right. So early onset sepsis. Sepsis is the death of the tissue, if I'm not mistaken.
Sepsis is the end stage of the infection. You know that if we have if a body have
Uh-huh.
if we body get infection, the first symptom is fever and the rising of the
Heartbeat.
white
Oh,
cell in
okay.
the
What cells?
laboratory. We can check white cell and the another cell like granulocyte and neutrophil, and then if we can we if you have infection, so you will try to therapy. What is the English? Maybe the treat it
Therapy.
or I can
The
say
treatment.
therapy or treatment. Yeah, I mean that we can treatment with the antibiotic, and if we fail to treatment with antibiotic, yeah, the next stage is SIRS itu SIRS. Nah, and then the next is sepsis.
Oh, I see. Okay.
The advanced stage of the infection.
Okay, so is there is there anything that the doctors do to save someone from sepsis?
Yeah, with the antibiotic.
Oh, okay. So the antibiotic is needed.
Yeah, with the with the optimal antibiotic.
Oh wow, that sounds scary. Wow. Okay.
Yeah, it's so scary.
Hmm.
Oh, that's good. Yeah.
Did you
Okay.
just stop sharing?
Yeah. Okay.
Okay. A preterm labor. What is that?
Preterm labor is the meaning. That is the meaning. Is the baby baby was born before the optimal
Oh.
gestational age. The optimal of the gestational is from 37 until 40. If you was delivery or if you was born the baby in the
Mhm.
below of this 37, we can say that that is a preterm.
Oh, okay.
But
So
if
the baby was
you
born immaturely.
delivery, yeah,
Mhm.
yeah, the baby was
Prematurely. Okay.
prematurely. Yeah.
Oh, okay. Okay, okay. That sounds complicated. This is this baby
Yeah,
alive now?
I don't know because it's
Oh, okay. So the baby is not your
I
patient.
met
Yeah,
this
okay. Got it.
I met this case in November the last year. So the
Okay.
it's so long. Maybe I don't know what is the current condition.
It
Maybe I
it
think
sounds like the baby
it's
is very
bad.
sick, you know?
Yeah, that
Looking at the
it
diagnosis, I mean, this baby
look
is very sick. Oh my god.
looking from the diagnosis that is for by the bad diagnosis, a bad
Oh my
prognosis.
god. Okay, okay. All right, all right. Okay. Please continue.
Okay, we continue. Okay, we continue this is the chronology. The chronology is um person was found in gestational age 3 weeks. The first time they diagnosed with severe bilateral ventriculomegaly and toxoplasma. And then person then referred to Sarjito. Nah, in 26 October 2002, in for the patient come to emergency unit. And then delivery in the maternal ward. In the maternal ward, in the 26, I forget. In the maternal ward, patient hospitalized at maternal ward and give a conservative management. The she has already get injection dexamethasone. She has get really injection of the magnesium sulfate. And then in 2 days after that, in gestational 32 and 32 weeks and 2 days, we choose the expectant management. And then
Mm.
baby was born spontaneously in such female but weight 119 1960 gram and body length 30 centimeter and head circum head circum and yeah, circum abdominans 29/24, and the Abgas score is 5/8. Can you understand?
She she's very small then.
Yes, she's very small.
You looking at the body weight, I mean only 1.2 gram. Well, what? 1.2 kilogram, like she's super small.
Yeah,
Oh my
she's super
god,
small.
poor baby. What is
That is true that
HC? Uh-huh. It's
what?
true that it's
That
true
is
that
true
what
that
you
I say.
uh-huh.
If I say 5/8 is 5/8.
Yeah, yeah, yes,
Okay.
25
Okay.
over 8.
Okay.
or 5/8. It's totally fine. What is HC again? NCC?
Yeah.
What is HC?
Oh, HC over CC is HC is that head head C head C head circum
Mm-hmm, mm-hmm, mm-hmm.
head circum is
Ah, okay. So,
yeah.
how
If
big the
the
head
baby was born,
is?
we can yeah. Oh, the big the
Oh, I see.
how big she has. We must measure
Ah, okay,
the big
okay.
of the big of the big
The
of
size of the head.
the
Okay.
size of the head.
Mm-hmm. What about CC? Is that chest?
Sisi no,
No.
Sirki. I think that is the wrong word.
Mm-hmm.
I think that is the mean is AC, abdominal
Oh,
circum.
okay. So the
Abdominal circum
stomach.
is diameter of diameter of stomach.
Oh, the
Hmm.
stomach. Okay, I see, I see. All right. Please continue.
Okay. That is the
Uh,
ultrasonography in the polyclinic in 26 October 2020
2020.
in the yeah 2020 in the gestational X 31 weeks 6 day. We have found that singleton fetus longitudinally cervical presentation fetal heartbeat positive Hoffman positive sufficient amniotic fluid. There is 7.79 centimeter and placenta on posterior body of uterus. And from the um, BPD,
Mm-hmm.
syndiate ventricle in the estimated fetal weight is 100, 100, 1,427 gram.
Okay. How do you see a baby on that picture? Because I cannot see anything.
Uh, that is the that is the we that is the what is the card. It's difficult to explain. I will try to explain
Okay,
with
okay,
my ability.
okay. Use
Uh,
your own words. Use the easy word. It's like you're explaining to your patient.
yeah, this is ultrasonography. That
Uh-huh.
is examination. We use the uh, voice, voice
Mm-hmm.
wave, voice wave. Yeah. So and then when the voice wave gelombang
Mm-hmm.
suara,
Voice
gelombang suara,
wave.
uh, voice wave,
Wave. Wave.
voice wave,
Yeah. Not wave,
wave,
but
voice
wave.
wave, yeah, voice
Wave.
wave,
Yeah. Good.
voice wave, voice wave, voice wave,
Excuse me.
eh,
Wave. Not wave. Wave. Wave.
wave, wave,
Wave.
wave, wave,
Wave.
yeah,
No. Wave.
wave,
A. See?
wave,
Wave.
wave,
Good. Nice.
wave,
Nice. Nice. Wave.
wave,
Yeah.
yeah,
Wave.
wave,
Good.
yeah.
Good.
There's the what's the meaning voice wave, voice
Wave.
wave, and then the reflections. I mean that memantulkan, and I think the voice wave it changed to be a figure in the computer. Yeah.
Mm-hmm.
Nah, in the left side we can see the feature of the brand. Nah,
Where's the
you
brain?
know
I cannot see the brain.
that is the brand that is head circums. At the
Oh, this is the head.
yeah.
Okay. Okay.
Yeah, that is the head. Nah, that is the ventricle. That is the ventricle. We can we
Which
just
which
we
are you
can
pointing at? I only see black color.
Yeah, the the
You're
is seafood.
frustrated. Okay, okay, please keep going.
Okay. So okay, okay. That is the pantry. That is the pantry. You know, that is the pantry. I see. I saw you. That is the pantry. That is the kind of the organ in the head. That
Mm-hmm.
is. I forget what is the pantry. Tonga. That is the dilated of this pantry.
Oh, okay.
Yeah,
So
in
the
the
size is
normal,
bigger
in the
than normal.
size, yeah, the size is bigger in the normal. In the normal, we if we measure from this point until this point,
Uh-huh.
I think the mount is more than normal limit. The normal
Okay,
limit
okay.
just 2 millimeter. Okay,
Uh-huh.
that is the diameter in the ventricle. This is of the circum abdomen circum. That is the
Okay.
diameter of stomach.
Uh-huh. Okay,
Yeah.
okay.
Okay.
All right.
So that is the normal in that is in the normal limits.
Okay, okay, okay. Singleton fetus. Does it mean a single
Single
fetus?
fetus
One
is
baby?
one fetus.
Why
One
singleton?
fetus
Why
in
not single?
the 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 word of the machine of single fetus. Janin tunggal.
Ah, okay, 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 okay. What about twin? Twin. Do you
Oh,
say twinton or what?
there is twin our we can say it gemeli. Hmm.
What?
Gemeli. You know gemeli now. Gemeli. The term is gemeli.
Oh, okay. That's different. That's different. Okay, okay. All right. So
Okay.
amniotic fluid is the ketuban, right? So
Yeah, that's right.
this mother has normal amniotic fluid.
Yeah, that is a normal
Okay.
limit.
Okay. So placenta on posterior body of uterus. Is that normal?
Yeah, that is not normal.
Uh-huh.
Placenta can the face of the placenta is the anterior or the
Mm.
posterior or the in the fundus of the uterus. If the placenta in the below of the uterus or covering the uterus,
Uh-huh.
that is not abnormal. That is not
Oh.
normal. That is abnormal because
Okay.
placenta the normal placenta is not covering the uterus.
Okay. So the
Yeah,
placenta
not
has to
covering.
cover.
Not I think. I mean, I'm sorry. I mean that not covering the ostium uteri
Mhm.
externum. Ostium uteri internum. That is the whole from uterus into the cervix.
I
I
see.
think.
I see. I see. I think I can picture it.
I think. Yeah, yeah. Okay.
Uh-huh.
I hope you can picture it.
Yeah. Okay. I hope what I'm picturing is correct. Okay. Next slide. You know what? Instead of you
Okay.
learning English, it's me learning how to be a doctor. Okay, singleton fetus, blah, 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 blah. I think it's the same, no?
That is the time of the ultrasonography, but
Okay.
this is that is uh, the feature is the ultrasonography in the first time when she come to doctor.
Mm-hmm.
Yeah, and then after the doctor found it, and the doctor refer the patient to Sarjito.
Oh,
That is
okay.
the first time of the USK. The
Okay,
picture of USK.
I have a question actually. When
Yeah.
when you decide to refer a patient, what is your considerations?
Uh, like general practitioner,
Mm-hmm.
every doctor have its competition. It's competition ya. It's competition. Nah,
Competence.
uh, ya competen ya
Competence.
kompetensi ya
Okay. Okay.
kompetensi
Yes.
competence
Competence.
competence yeah, you know that competence. Each of
Competence.
doctor have a competence. Yeah, each of doctor have competence.
Competence. Yeah.
Okay,
Good. 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 Good.
competence. Yeah, or competence. That is already I've already errors in our curriculum.
Mm.
Nah,
Okay.
if we found that baby in the abnormal in need treatment in expense in the expert need a more expert, then we must refer to another level of the hospital. I mean that hacker from our hospital.
Mm. I see.
This baby need the treatment from another department, like another expert expert from the perinatology. And then we must refer to the hospital which
Mm.
is more complete, more expert.
I see. I see. Okay. So your first consideration is that when you refer a patient, the hospital that you work at is not sufficient to treat the patient, so that you have to refer the
Yeah,
patient to a bigger one. Okay. Okay.
yeah.
I see. I see. Okay. Next, please.
Yes.
Okay.
That is the strategies cardiotography. That is the feature of we can describe of the condition of the baby from this picture.
How?
It's contain five um expertise. The first is
Okay.
fatal heart rate. That is the name of fatal heart rate. It is the average
Okay.
of the heart rate. Okay. Now that is the wave is so that we can say that it accelerasi or decelerasi. If we found that deceleration,
Mm-hmm.
the meaning is the wave fall down until more than 15 seconds, we can say that that is not abnormal condition the baby. We must be careful. We must do some resuscitation to improve the condition of the baby.
How do you resuscitate a baby that is not born yet?
Um, yeah, just improve the current condition. Not the originate, but just the current condition.
Mm.
Like maybe uh, some of the one who in dying. Now,
Mm-hmm.
one before dying, uh, people will fear that the blood, that the respiration is decreased,
Oh.
the heart is increased. Nah, we in the normal fever, in the adult fever, we can give the medicine. Nah,
Okay.
baby is almost have a stressful in the uterus. Baby has almost stressful in the uterus. The cause sometimes like the cause it's antara lain what is like the
For
symptom of
example,
the symptom of the the symptom of the stress of the baby. Yeah, for the example, like the cause of the like compression in the abdomen, and maybe it's difficult to me to explain to you. Something like the infire from the utero placenta
mm,
flow, something like that we know that the supply oxygen and the supply of food to baby is from the mother.
mm-hmm,
Nah,
mm-hmm,
the supply we can deliver it from the placenta. If you if the placenta is broke, infection, our the flow is in trouble. The
mm-hmm,
baby will
mm-hmm.
be stressed. Nah, so if the baby stress, they will show the abnormal feature in the cardiotopography.
I see.
We
Okay.
can correct the we can correct the stress with the Ranger Lakat. Yeah, I think that you can give oxygen, you can give the
I see.
fluid. Yeah, um, you can to assist the mother to sleep in the left side. Yeah,
I see.
you mean
Okay.
yeah, sleep in
Mm-hmm,
the
mm-hmm. Sleeping on the left side. Okay, so that
yeah, sleep.
works.
Yeah, sometimes it's good.
Okay, why left, not right side?
Right side, right
Yeah,
side.
what? Right or left?
Mhm. Left.
Left, right? So why left side?
Left.
Why not right side?
Um, it's about the position of your heart. Your heart
Oh,
in
I
the
see.
heart.
Okay, okay.
Your heart in the left side, not the right side.
I see. I see. I have a question actually. Do you feel tired yet?
No, no.
No?
I feel
Okay.
more happy. It's
Okay.
okay to me.
Because you've been explaining this stuff to me, and I'm not a doctor. I don't have that basic knowledge, so you have to struggle. So are you tired? If you're tired, then we can continue
Uh,
like
are you understand what I
on
say?
Wednesday. Yeah,
Are you understand what I say
yeah,
in the
yeah,
English?
yeah,
Are you sure?
yeah, yeah. Totally
Yeah, I
understand.
mean that. Okay, it's good.
Yeah, see, your English is good. As long as the
Ah,
message is right.
yeah.
It's improving. It's improving. The point is you have to practice a lot, and that's it. Don't worry about the grammar. Okay, so you ready to continue, or do we stop here?
Okay, I will ready. That is the feature of
Oh
the baby
my
condition
god!
at
Oh my
one.
god!
There is
She's so
the
small.
condition in yeah, it's so small. Just 1,000
Oh
uh to 220, 290.
by the way, The baby on the right looks smaller than the baby on the left.
Yeah.
What? How come? The baby is getting smaller in
I
my
think
opinion.
I think the baby was scared. It's difficult to survive with this current condition. With
Oh,
this
oh
condition,
my god.
I think I don't know
It's so
what's the matter,
small. Oh
but
my god. Okay. I mean, look at the color of the skin. The color is not right. Oh, poor
yeah.
baby. Oh, poor baby. Oh my god. Okay, you can explain.
Actually, I just can explain from the
Mhm.
picture because
Okay.
honestly I don't know how to say the condition of this baby because
Hmm.
that is not my
Okay, she's
expert.
not your patient. Okay.
Uh, yeah, that is not my passion. Uh, but from this picture, we can see that is the lung have a retraction.
Mm.
Retraction, the meaning it's the coste, and inside in the body. Yeah, you
Mm.
know that. Then but from this condition, the diameter of the size of the head is normal, I think.
Mhm. Mhm.
Mm-mm. And that's that I can explain.
Okay. 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 So next slide then.
That's right. Okay. Pedigree is the history of the baby. Like Nyonya A with
Oh, okay.
the
So where the
father.
baby
Yeah,
comes from?
the pedigree is yeah, where the babies come from. There is the father with age 24 and the mother with age
Uh,
23 with a positive
oh my God, they're still so
and
young.
yes, this
24
still
and
young.
23, and they got married, and then they have children. They're still young. Oh my God.
Yeah.
Oh my God. Okay. Okay. I know why I couldn't be a doctor, because I'm too sensitive. I say oh my God a lot.
Okay. It's okay.
All right. Okay. Next slide then.
Next slide, that is the anthropometric status. Mm, the baby was born with the birth weight 1,290
Uh huh.
and body length in 40 centimeter and the HC over CC is 29 over 24 centimeter. For the if we suitable from the curva,
Uh huh.
the birth weight is still enough appropriate for the gestational age.
Okay. Okay.
Yeah.
Okay.
Okay.
Mm-hmm. Mm-hmm. I'm trying to understand from the picture.
Yeah.
Are you texting someone? If you're texting someone, then take your time, please.
It's okay. It's okay. I just take my handphone because in the as soon as possible I
Uh-huh.
will have meeting with my senior. But I still have my friend share the link of the Zoom. But it's okay. We can continue until the announcement. If I must join the another, when join this, when the join the link
You know
with the
what?
link.
Let's do it for 1 hour and a half only for today because I think you have to prepare for the meeting, right? We can meet again someday.
Oh yeah, it's okay if I will continue. What about you? Are you do you have another event or
After this, no. But you look
oh
like
yeah.
that you're very busy and
No,
you have to.
I'm just not waiting.
Okay, you have to
Okay, I'm
prioritize
just
your patient.
okay. Okay, I will continue this.
Okay, okay.
Yeah,
But
that
I,
is
I, I
physical
just I just
examination.
want to make sure that you don't have that emergency patient or anything.
No, no.
Oh, okay, okay, okay.
I'm just watching announcement from my friend
Mm. All right.
uh to join the link of the
Okay. The
what
meeting.
report next report next report
Okay.
in with my senior in this night, but I am
Okay.
still waiting the link. Mm.
Okay. Okay. Let's continue then.
Okay, that is the physical examination. From general condition is
Mm-hmm.
special movement with that is the condition is normal, but for the abdomen we can we have found the distended hypertrophied 3 centimeter under costal,
Oh,
and
okay.
another condition is normal. Yeah.
So what's wrong with the hepar though? Why is it not normal for it to be palpated 3 centimeter under the costal arch?
Because if we forfeited the hyper,
Mm-hmm.
we we can fund we we can feel the lung, you know in the
Mm-hmm.
normal
Mm-hmm.
we can
Okay.
forfeit the hyper. In the normal we can forfeit the hyper,
Okay.
but
Okay.
if you forfeited you can forfeit the hyper, that is the sign of the abnormal.
Ah, okay. So hepar should not be palpated.
Yeah, hyper
Oh, I
should not
see.
be forfeited.
Okay, 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 okay.
Yeah,
All right. What is anal dimple? Why is there a dimple in your anus?
I don't know
What is
what that is the
what is that?
diagnosis of
Okay.
peritoneal. That is the diagnosis of peritoneal. I just take
Okay.
take the diagnosis. Really, I don't know
You
what
know
is
what I'm
the
imagining? You know what I'm
yeah the
imagining?
deal
There's a
maybe
dimple in
yeah yeah.
anus. I'm like, what? Okay, 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 okay. Extremity normal. Extremity is the is
No,
the hand and
because
feet.
if
No? What?
the baby don't have a dimple in the if the baby don't have a dimple, that is so the abnormality, maybe
Oh, okay.
obstruction in bowel or obstruction in the small intestine.
Ow. Ouch, ouch. And that's not good, right? Obstructions are never good.
Yeah, yeah, yeah.
Okay, okay.
Observation or maybe the baby have lost the neuron or ganglion
Oh my
in
God.
the bowel.
Okay.
Yeah.
Okay, okay, okay. It's getting more and more scary. I hope this baby is okay. Is she alive?
I don't know I don't know what is the current condition.
Poor
I
baby.
think it's difficult to survive in this condition with this condition
Because of the sun.
because of the conviction of that they have that she had.
Hmm. Okay. Well, next slide then.
Yeah, that is the laboratory. The
Wow.
laboratory show that the decrease of the leukocyte, decrease of the white cell.
Mm.
That is the sign of the infection too. And from the
Okay.
hemoglobin is normal limit, and erythrocyte in normal limit, hematocrit in the normal limit, thrombocyte in the abnormal
That's
limit. The thrombocyte is
crazy.
decreased, and the
That's very
thrombocyte is
small
decreased
amount,
from
right?
the normal. Yeah, just 47. In the normal is 150,000.
Oh my God.
150,000
Okay. Okay. Poor baby.
for
Oh
the
my
albumin
God.
in normal limit, in the CIP in the normal limit, glucose in normal limit. We can find the IgM antitoxin in
Mhm.
increase from in the 4.96, and the IgG antitoxin we found the increase in 136.
Wow. Okay. All right. All right. Oh my God. It's so hard
Yeah.
for the baby to survive.
No, that is the laboratory of the mother, not
Oh,
the
the mother. Oh,
baby.
okay. Wait, the
Yeah,
thrombosit.
yeah,
The mother's thrombosit is so low, man.
yeah.
So what
So
what what do you do? What did you do? What if you're the doctor, what would you do?
no. I forget that is the laboratory of the baby.
The
Yeah.
Okay, so which one is it? The
Yes,
babies or the mothers?
the
The
baby.
babies. Okay, okay. All right. Move to the next
Mhm.
slide.
Yeah, that is the laboratory of the baby too. Uh, for the baby direct, that is not normal limit. That is the increase in the value 3.99, 1.27, and 5.19. And the
Okay.
laboratory of Mrs. RST in October 10 in 2020. For
Hmm.
ADA toxoplasmosis, the result is increased with over 300 intra-unit, and ADM toxoplasmosis is increased 5.66, 69 in
That's high,
AGG.
right?
Yeah, yeah,
That's very high. Oh,
that
so
is
this
high.
the mother
That's the,
is toxoplasma positive.
yeah, the
Oh my
model is
God.
toxoplasmosis.
Okay, okay. Poor mother.
Nah, the baby was done baby examination. In the research is in the thorax we can find bilateral pneumonia, normal head configuration. From the abdomen we have found distension of abdomen, seen gastric tube with distal tip on the stomach projection. UVC is installed with tip toward cranary on right very vertebrae projection at level of VTH to its body.
What does it
From
mean then?
this decimen is the there is the baby had pneumonia in the lung, and the
Okay.
another, yeah, that is from the babygram. The babygram is like a ronsen
Okay, like an
in the
X-ray
head
of a baby.
now. Yeah, X-ray in the head.
Okay. But why do I see it like this baby has a very big stomach? Is that normal?
Mm, it's not abnormal. Maybe I don't know. I'm sorry.
Okay.
Forget why this baby
She's
is
not your
not
patient.
producing
Okay,
this.
okay. Got it, got it. Next slide
Uh,
then.
that is from the head ultrasound. So in the 29 October, uh, it has already uh, had ultrasound examination from
Okay.
this. The result is ventriculomegaly. I don't
Mm,
know how to explain this picture because that is the perinatology diagnose.
okay,
So I'm not
okay.
in expert in this
Okay, got it.
expert.
Okay.
Uh, this is from the CT scan in the head of the baby. We
Okay.
can see the microcephaly, hydrocephalus communicant with subcortical bilateral periventricular calcification, bilateral frontalis region, picture of toxoplasmosis. They had cisternal magna and not seen anomaly on neurocranium neither fish cranium. We can conclude that is we have found the hydrocephalus, microcephaly, and calcification in the brain. There is the show of the brain damage that is so bad for
Mm-hmm.
for the prognosis.
Wow. Okay. Dilated cisterna magna. The language is so Latin banget ya.
Yeah.
Oh. Okay, next slide. Or do you have to go now?
No, not
No.
yet.
Okay.
I'm
Oh, okay.
still waiting. I will take my phone
All right.
when the wait a minute. I think there is still no morning report, complete question, and then maybe wait a minute.
Okay.
Uh, Okay, well, I mean, I will to try to join this Zoom
All right.
and I will check what is the condition of.
Oh, okay.
Sudah dipastikan ya, apalagi dia di bangsa luar. Jadi Mbak Sasa nanti harus memastikan benar-benar obatnya akan dimasukkan ya. Gitu. Kalau yes, not. Aku tungguin di situ sampai benar-benar perawatnya. Yeah, there is.
There's a
I
meeting, I
think
guess.
it's the
You
right.
have to go.
Yeah, there is. No, no.
No? No?
Um, no, they are not start the meeting.
Mm, okay, okay. But I think they're talking about a patient there.
Yeah.
Oh, okay. So do you do this every day? You have to discuss every day with your teammates and seniors?
Yeah. Not with my senior, with my chief. Every night. That's annoying. Long day. Yes.
Okay, so you have to report to your.
Listen. Yeah.
Okay, so you always have to report to your
Listen.
chief? You have a chief
Yeah.
there.
In the every night. Yeah. Anything. Every
Okay.
night.
So it's the
so
chief
annoying to
senior.
have. Yeah, the chief is senior,
Oh, okay. Yeah,
but
that
I'm so
sucks.
annoying to have the voice. Blah 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 blah. You say, just say yes. It's okay, sir. It's okay, miss. Okay, sir. Yeah, just say.
Yeah, whatever she
Um,
says, you say yes, right? That's how we do
yeah.
with that's how we deal with chief. Okay, continue.
Yeah. Oh yeah, that is the. Wait a minute. I will say that. No, 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 no. Okay.
Okay, you ready?
Okay, I'm ready.
Oh, okay. Whenever you're ready.
First, I'm ready. So it can continue.
Okay.
Yeah, that is the negative. Uh,
Mm-hmm.
the analysis is passion from GA GA 51 weeks. They mother
Mm-hmm.
with age practice asymptomatic UTI fetus reverberation to making. Miss, I'm sorry.
Mm-hmm.
The meeting has
Yeah, sure,
cut,
sure. Yeah,
so
yeah, yeah. Okay, okay,
maybe
okay. Right,
we
leave
can
now.
stop now
Sure,
and
sure.
we can continue. And thank you very much.
Okay, okay.
I'm
Thank you
sorry
very
of my
much.
mistake.
Okay, bye-bye. Bye-bye.
Uh, yeah. Okay.
Okay,
Bye
leave
bye.
now. Leave now. Leave now.
Okay.
Okay, bye.